This is Dr. Monica Du, board-certified pediatrician, wife, and mom. And in this video, we're talking all about poops. So, you've had your first baby. There are so many things going on. You have transitioned from leaving the hospital and now you are home. Now, you may be curious about what frequency your baby should be having their pooping and stooling, and you might not really know whether or not they're supposed to have a poop every single time they feed. Is it once a day? Is it even more spread out? So, let me give you some information and tips so that you know what to look for and some important specifics that can help you if there should be a cause for concern. So, one, in normal newborns, they will have something called meconium stools. These are very thick, dark colored looking stools that are normally the first ones to pass. Usually, it is a specific thing that they must do before they leave the hospital. Normally, the pediatrician will be checking to ensure that they have had their first void or urine and that they have passed some stools before they have left. This ensures that their GI tract is functioning well as their bladder and kidney function. So meconium stools are the first ones that would have passed, and you'll normally have those for the first several days or so. After your baby has passed those meconium stools, you will start to notice that the stools are looking different. They usually now look yellow to green, seedy appearing. This is going to occur more frequently in breastfed babies on average, as breast milk has components in it that often help to soften the stool. So breastfed babies oftentimes have these transitional stools that look yellow, seedy, mustard looking like, and they often have it after every feeding. Now, breastfed babies on average do feed at least every 2 hours or so, and sometimes even more frequently, sometimes ad lib feeds or cluster feeding, where you may have fed them and within 30 minutes or less, they're ready again to feed. So these transitional stools are often noted after those first few days, let's say around days 2 through 5 or so. Honestly, it depends on the infant and what they're feeding. After the transitional stools from the soft mustard seedy-like consistency, you may start to notice that the stools become a little bit firmer and larger in bulk. And this can also be different from a breastfed baby to a formula-fed baby. Formula-fed babies tend to have a little bit more darker green color to their stool consistency, and they tend to have less frequent stools than the breastfed baby, unless perhaps they have some formula intolerance that is causing their gut to push forth the stool in a little bit more frequency than would be normal for them. Now, how many times on average should your baby be stooling after we have moved from meconium to transitional stools to the more normal, regular pattern and more formed but still soft stools? Well, it really depends. Some babies will stool every day and with increased frequency. Some may stool after every feeding. So that means you may be getting between 1 through 7 to 8 stools per day, or sometimes even more. Some babies do not stool every day, and I oftentimes do get that concern that a mom may feel that their baby is constipated, but this is not specifically constipation. There can be slower stool passage from one baby to the next. Some babies are just not having those more frequent stools that we may expect. Sometimes they will even miss several days without a stool, but as long as when it comes out, it is not hard like a rock or like pebbles, it's not causing significant pain from the hardness. This is not constipated stools. Constipated stools will be hard like a rock. Yes, it can take several days. You may have delayed transit of stools, but they are inherently normally very hard and formed, and they can cause significant strain. Now, this is also something that I often hear. Some moms feel that since they see their baby pushing with lots of effort, that this is constipation. This is also not constipation. The baby does not have the same ability as you and I, of course, to sit on the toilet and allow gravity to help pull things down. So they do have to make some concerted efforts to get that stool out. But if when it comes out, it is soft, there is no blood, there is no abnormality with the stool, it is normal. And what you can do is help to massage the tummy. You can usually even go in the anatomical pattern of stool passage, which is what I do. I'll start from the lower right side, move up, go across, and then down, ending on the left. This is the normal anatomical pattern of the colon, going from the ascending colon to the transverse colon and down the descending and gently pushing down so that you can encourage and coax the stool to move. You can also bicycle the baby's legs, and that can also help to mechanically move the stools further down to help them have a stool passage. So, we have discussed moving from meconium stools, those transitional stools, and the more formed but still yet soft stools that babies routinely being fed will have. Now, what are some red flag signs that you should be aware of if ever you see these stool patterns happening in your infant? Blood, excessive amounts, of course, is always a concern. Or very black tarry stools after your infant has already passed their meconium. This is a problem, and you need to ensure that you seek immediate medical attention. If the stools are also chalky and white looking, very high in tan color, that is not normal, and you should discuss it immediately with your healthcare provider. Another red flag sign would be persistent watery diarrhea. So, of course, as we talked about, your newborn stools are normally going to be nice, mushy, and soft. That is normal. But if the stools are coming out like faucet water draining down and out the diaper. That is not normal. That can signify that there is some diarrhea happening or a malabsorptive problem that needs to be addressed. So seek immediate medical attention if ever you see any of these things, or in general, if you have a question about your infant stooling, please let your medical provider know. So I hope that this has been helpful to you and given you a little bit more insight regarding stooling and the patterns that are normally seen. If you have any questions, you can drop them in the comments below. And as always, stay well, and I will see you soon.